morning, this is Dr. Salma Aziz, and today we will talk about orthotics and how they benefit bunions. For those of you that missed the video on orthotics, a quick recap. We're talking about custom orthotics that are fitted for patients based on taking a mold of their foot and making the specific orthotic for their shoe type, activity level, so that it has a very custom, good fit to it. Now let me direct your attention to the various types of orthotics. As I said, we have very thin dress ones that we can offer for female patients. We have 3/4 length ones that typically work well for the average male patient who can use it in sports shoes as well as their daily work shoes. And then the full-length sport orthotic that is can be custom made to accommodate all types of various sport activities. So when we talk about bunions, if you had the pleasure of seeing my information on bunions, we talked about how a bunion deformity is basically genetic, and it has to do with the abnormal mechanics of the foot and ankle that genetically was passed on to the person. So to just use the 3/4 length, how an orthotic helps to prevent a bunion is as follows. The simplest way to think about this is this. We have mechanical imbalance in the most important part of the foot, which is this subtalar joint, which is the joint below the ankle joint. This is not functioning properly. As a result of malfunction of this particular joint right here, ultimately the big toe joint where the bunion deformity forms is affected, meaning there's an imbalance there. This imbalance creates the following, and we have done this before, but a quick recap. The big toe joint moves closer to the midline of the body. The big toe goes closer to the pinky toe, the smaller toe, creating this painful bump, also known as a bunion. So the way we prevent this, or the way we slow down this deformity, is by means of an orthotics. Well, how? As I said before, an orthotic controls the mechanics of a foot. It puts this foot in a more anatomical position to make this a better functioning machine. And since we said people that suffer from bunions often have arches that collapse, therefore leading to this bunion, if we make an orthotic that maintains this foot and ankle in that neutral position, as I demonstrate, where the foot and ankle is not collapsing, then what we're able to accomplish is we are making this big toe joint function better, thereby either slowing down the progression of the bunion or completely halting it. And that is how orthotics benefit bunions. Thank you for watching today, and hopefully today's educational message was of use to you guys. Have a great day.